My name is Lynette McLaughlin. I'm a registered nurse. I'm going to be completing a pediatric and full abdominal assessment. Zach is a 9-year-old boy who's agreed to do the videotaping with me. Zach, do you agree to be a patient in the exam?
Yes.
Do you agree to have the videotape sent to Olivet Nazarene University?
Yes.
Additionally, I obtained consent from Diane's parents for this video. We're going to start by scanning the room. Showing the note card. The exam begins with me washing my hands. Vital signs on Zach: temperature of 97.4, respirations of 20, a heart rate of 100, a blood pressure of 102 over 54. Zach is 53 pounds and 50 inches. He's in the 10th percentile for his weight and the 15th percentile for his height. He has a body mass index of 14.9. He is the appropriate height and weight for his age. He's well nourished and no apparent distress. How you doing, Zach?
Good.
You're good? Okay. So we're going to start the exam with a head assessment. I'm going to be palpating the scalp for any tenderness, lesions, bumps, anything like that. I'm noting that Zach's hair is shiny and thick. There is no lice or anything in the head. To start the test, Zach, we're going to test two things. We're going to test cranial nerves 5 and 7. Cranial nerve 5. Can you feel that?
Yes.
Okay, and cranial nerve number 7. Can you wrinkle your forehead? Can you close your eyes? Can you stick out your tongue? Good job, Zach. Very good. Okay. All right. Zach has normal faces. He has a normal head shape and circumference. We are now going to move into the eye assessment. I'm going to start with the red reflex test. I'm going to go ahead and examine Zach's eye. And I am getting a red light on Zach. Okay. Go ahead, turn the light on. Zach, I'm going to have you watch my finger now. And if you can follow this. As I'm watching Zach's eyes, he has no extraocular movements. His pupils are equal round reactive to light and accommodation. I'm going to look at the sclera. The sclera is white. And no inflammation noted to the conjunctiva. No nystagmus, no strabismus. As we were doing the eye exam, we were testing cranial nerves 2, 3, 4, and 6. Now we're going to go into Zach's ear assessment. I'm going to start with a test. Zach, I'm going to whisper a word in your ear. Can you tell me what it is? Okay.
Blue.
Good.
Apple.
Very good. I'm going to perform a otoscopy exam. Good visualization of the tympanic membrane. The tympanic membrane was translucent. There was no perforation, no bulging noted. A little bit of soft brown wax noted to the left ear. The pinna is appropriate and well formed. I'm going to go ahead and do an otoscopy exam to the right ear. Again, good visualization of the tympanic membrane. It did look translucent. No perforation, no bulging noted. Pinna is very good and appropriately sized. Okay. You know what? I'm going to go ahead, Zach. We're going to check your nose. I'm going to go just look upside your nose. Good. Mirrors are moist. There's no deviated septum. I'm going to do a turbulence test. Go ahead and look. Good. Very good. Okay, very good. So now we're going to move in to an oral exam. Can you open your mouth, Zach? And can you stick out your tongue? Good. Tonsils look 1+. No caries noted on the upper teeth. Go ahead and bring your tongue back in, Zach. Good. And open your mouth. Very good. Can you move your tongue back and forth, side to side? Very good. Gums are pink and moist. His whole oral cavity is moist. All right, let's see. Palpating the thyroid, which is midline. Go ahead and swallow. And if you can open your mouth one more time, tilt your head back. I want to look at that uvula, and the uvula is midline. Very good, Zach. Okay. When I was having you wiggle your tongue, I'm going to have you blow. Very good. And stick your tongue here. And stick your tongue. And that's testing cranial nerves 9, 10, and 12. Okay. I'm going to go ahead and assess Zach's lymph nodes. We're going to start with the posterior cervical and anterior cervical, pre-auricular, post-auricular, submandibular, submental, supraclavicular, and axillary lymph nodes. Very good. You are doing super good. Okay. All right. Now I'm going to feel for his carotid pulse. And I'm going to listen for any bruit on the carotid pulse with the bell. Good job. Good job. No bruit. I'm going to have you turn this way. You tell you what, Zach, turn this way. You can turn the other way. I'm going to go ahead and do a posterior lung assessment. On Zach. Again, first palpating for any crepitus, tenderness, air trapping. Take a deep breath. He has a symmetrical thumb expansion. I'm going to percuss. And I'm going to auscultate starting at the apex of the lung bases using the diaphragm. Take a deep breath. Good. Okay, you can turn around. Zach had clear lung sounds throughout all bases, no rhonchi, no rales, no wheezes noted. I'm going to go ahead and palpate again. Go ahead and say 99.
99, 99, 99, 99.
Okay. Take a deep breath from me, Zach. Zach has symmetrical lung expansion. I'm going to go ahead and auscultate. Deep breath. And clear lung sounds throughout all bases. Again, no wheezing, no rales noted. Go ahead and turn it one more time, Zach. Say 99.
99, 99, 99, 99.
Again, that is assessing for fremitus. Zach is negative for any tactile fremitus. Okay, Zach. We're going to go ahead and move into the cardiac assessment now. I'm going to listen with the bell and the diaphragm after I go ahead and palpate. So I'm going to palpate the mitral, aorta, pulmonic, Herb's point, tricuspid, and mitral. I'm going to palpate for the point of maximum impulse. You're doing good. And again, with the diaphragm and the bell, I'm going to start with the diaphragm. Aortic, pulmonic, Herb's point, tricuspid, mitral, aortic, pulmonic, Herb's point, tricuspid, and mitral. Zach, you're doing a really good job. As I was listening to his heart sounds, I was hearing S1 and S2, no thrills, no heaves, no bruits noted, and no pericardial bulging. Okay. I'm now going to have Zach lay down. Zach, if you could lay down up here, we're going to start the abdominal exam. Good job, Zach. You're doing so good. Okay. I'm going to begin by inspecting his abdomen. I'm just doing a visual inspection at this point. His umbilicus is midline. I don't see any notable hernias. I don't see any peristalsis. All right. I'm going to listen to his arteries now, again with the bell of the stethoscope. Again, I'm going to start with the aortic. I'm going to go into the renal artery bilaterally, the iliac artery, the femoral artery, okay, as I'm here, I'm going to palpate the inguinal lymph nodes. Okay. I'm now going to listen, I'm going to auscultate all 4 sounds of his bowel quadrants. Left to lower quadrant. I'm assessing for bowel sounds. Good job. Right lower quadrant. He has active bowel sounds in all 4 quadrants. I'm now going to percuss and palpate his abdomen. So as I percuss, I'm noting for any dullness or tympany. I'm going to palpate his spleen. Does that feel okay, Zach?
Yeah.
Okay. This is his liver. On the other side is the spleen. Does that feel okay?
Yeah.
Again, as I'm doing this exam, I'm noting for any guarding, any masses, any rigidity. Okay. And again, noting the femoral arteries. Okay. Zach, as we're down here, I'm going to check for 2 more tests. This is going to look for meningitis. So I'm going to look for the Kernig sign. Could you bring your knees up? Bring your knees up. Yep, just like that. Does anything hurt?
No.
No pain. Okay, go ahead and bring them down. Could you lift your head? Good job. Does anything hurt when you do that?
No.
So this would be a negative, negative signs of meningitis at this point. Okay, sit up for me, Zach. I'm going to check for the costovertebral angle right now. So I'll start on this side. What I'm looking for at this point is pain. Does that hurt?
No.
Okay, and I'll go ahead and get it on the other side as well. Does that hurt, Zach?
No.
Okay, all right, great. Okay, I'm going to assess for the deep tendon reflexes at this point, Zach. You're doing a good job. You just do what you're doing, okay? All right. Good. Okay, relax that leg for me, kiddo. You want to scoot back just a little bit, Zach? Good job. Okay. Okay. As I did this, the brachial radialis, the bicep, the tricep, the patellar, and the Achilles again. The brachioradialis, the bicep, the tricep, the patellar, and the Achilles. You're doing really good, Zach. Thank you. Okay. At this point, we're going to defer a genital and rectal exam. If we were doing one, we would be able to have a Tanner stage for Zach. We're not going to do that. When we're doing an exam of the external genitalia on a boy, we would notice that the testicles had descended. We would look for any masses in the testicles, anything like that. Again, we're checking to make sure there's no hernia pain or anything. We would go ahead and do, and for a rectal exam, we'd be noting for any fissures, any hemorrhoids, things like that, but we're deferring that exam entirely. Okay, as I'm completing the exam on Zach, I am looking at his skin, color throughout the skin. His skin, again, is pink and warm and dry. He's got very good skin turgor. I'd be noting any bruising or lesions on his skin, any excessive scarring, okay? All right, Zach, we're going to do range of motion, okay? So I'll tell you what, while you're laying there, why don't we just lay you back down? We're gonna check your hips out and your knees out, okay? So to do range of motion of your knees, can you bring your knees out? This would be the flexion, and go ahead and bring your knees out straight. That's extension. I'm looking to make sure at hyperextension that we've got a straight line here, okay? Zach, I'm gonna check your hips, okay? All right, go ahead and bend your knees again. Good. Can you lift your butt off the ground a little bit? This is flexion, this is extension. A little higher, Zach. That gives me hyperextension. Again, I'm noting Zach, he's doing this without pain or pause. Okay, go ahead and come down, kiddo. Good. I'm gonna go ahead and do an internal rotation of his hips, an external rotation of his hips, internal rotation, and an external rotation. Good. Very good, Zach. Again, I'm noting any guarding any pain, any tenderness, any clicking, anything like that. All right, come on over here, kiddo. I'm going to perform the exam for soft touch. Can you feel that, Zach?
Yes.
Can you feel that?
Yeah.
Feel that?
Yeah.
You feel that?
Yeah.
That?
Yeah.
Okay. I'm going to bring them up right now. Again, assessing the skin color, tone, temperature. Can you feel that?
Yeah.
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 Good. Yeah.
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 Okay. Now we're gonna start with your fingers. We're gonna test for range of motion of his extremities. So again, Zach, let's do flexion of the fingers. Close your fists. Bring them out for extension. Bring them out again. Okay. Bring them up. That's hyperextension. Bring them out for abduction like this. Bring them in for adduction. Can you bring your thumbs together for thumb opposition? Again, without pain or pause, showing us that he does have good range of motion of his fingers. Good job. Okay, ready for your wrists? Okay. There you go. Flexion, extension, hyperextension, radial deviation, ulnar deviation, bring them in, and circles. Very good without pain or pause, very good range of motion of the wrists. How about your elbows? Bring them together for flexion, extension, hyperextension, and some circles. Good job. Ready to do your shoulders? You're doing so good, Zach. Okay, go ahead and let's bring them out. Flexion, extension, hyperextension. Hug yourself in the back. That's internal rotation. Give yourself a bottom hug. That's external rotation. Straight out, abduction. Bring them in for adduction and some circles for circumduction. Very good, Zach. You're doing really good. Now we're just going to do a couple more tests, okay? All right, so we're going to now check his range of motion of his ankles. Go ahead and do a dorsal flexion. Bring your ankles up, both of them. Bring them up together. Bring them down for dorsal flexion and give me some circles for ankle circumduction. That's really good. All right, Zach, stand up for me. Can you take a few steps and turn around and walk back? And can you do heel to toe walking like this? Again, noting his range of motion, his age appropriate, he follows commands very age appropriately. Good job. Okay, I'm going to check him for scoliosis. If you can bend forward, Zach. I'm going to lift the shirt up just a little bit for you, okay? Again, I'm going to palpate the back. Again, checking the skin, the color, the temperature, the moisture. He's got warm pink skin. There's no scarring. There's no bruising. You're good. Okay. Normal curvature of the spine. Bend forward. Good, Zach. Zach, that is a negative assessment for scoliosis. As I complete the exam, what I'd like to say is that Zach acted appropriately. We tested his cranial nerves. He was responded appropriately to questions. He's calm and coherent, and he has clear speech. This concludes our exam. Thanks, Zach.